Are you struggling to find ways to prevent burnout in your medical practice? Do you feel overwhelmed by the demands of your profession? Are you wondering how to balance patient care while caring for your own self? In this video, I'll share effective strategies that can help doctors reclaim their energy and passion for medicine while maintaining a healthy work balance. Hi, I'm Dr. Ariana DeMers, and I am leading the way in orthopedic surgery innovation and shaping medical practices for success. In the quest to prevent Dr. Burnout, I will share some important strategies, but there's more to the story. So stay tuned as I talk about game-changing benefits of orthobiologic treatments for medical practices. Discover how this innovative approach can actually revolutionize patient care and set your practice apart, all the while helping with burnout. So let's start. So how can doctors prevent burnout? Let's address a crucial issue in our profession. How can doctors prevent burnout, especially when it stems from moral injury? First, let's distinguish between burnout and moral injury. While burnout is a result of chronic workplace stress, moral injury occurs when we're forced to act against our deeply held moral beliefs due to the systemic or systematic constraints. So to address this complex issue, I'm going to consider these following strategies. Number one, prioritize personal time. Dedicate time for yourself outside of work. Engage in your hobbies, spend time with loved ones, maintain your physical health through exercise or meditation. Create clear boundaries between work and personal life, and don't underestimate the value of regular breaks and vacations. If work is your hobby, find a new hobby. Next, streamline clinical tasks. Implement efficient systems like electronic health records. Leverage AI, like AI Scribe, document generation, and delegate those tasks that you shouldn't be doing. Automate those repetitive tasks where possible. And this optimization allows you to focus on more important things like patient care, and it potentially reduces feelings of overwhelm. Number three, set meaningful goals. Define clear, achievable objectives for both professional and personal life. This might include learning new medical services like PRP or improving your work-life balance. Regularly revisit these goals to ensure that they align with your aspirations and your values. 4, acknowledge the root cause. Recognize when you're experiencing moral injury rather than burnout. This awareness can guide more effective coping strategies. 5, seek peer support. Connecting with colleagues who understand these challenges. Make sure you consider forming or joining these support groups. Seek out like-minded physicians who fill your cup and recharge you. Engage in reflective practices. I like to use journaling or meditation to process these difficult experiences that we all go through and maintain our sense of purpose. And then set boundaries. Learn to say no to excessive demands that compromise your ability to provide quality care. No is a full sentence. Finally, please consider cash-based practice. Transitioning to cash-based practice offers doctors more control over their work environment as well as patient interactions. This model eliminates the complexities and stress associated with insurance paperwork, reimbursements, and this allows for a more straightforward financial relationship with your patient. By reducing those administrative burdens, doctors can spend more time on patient care and less time on all the other bureaucratic tasks. This approach gives doctors the autonomy to price their services, enabling them to ensure fair compensation, get paid for your time and expertise. And this flexibility can enhance quality of care. as doctors can set their own schedules, limit their patient loads, and further help prevent burnout. Remember, addressing moral injury requires both individual and systemic approaches. While these strategies may help mitigate its impact, true resolution often requires broader changes in the healthcare system. By implementing these strategies, you can work towards preventing burnout, addressing moral injury, and maintaining your passion for medicine. It's crucial to prioritize your well-being and ensure that you can continue caring for your patients. As we know, we've always heard about this learned helplessness where the dog is in the cage and it's electrified and it's zapped and it gets used to being in the cage and gets used to being ineffective at changing the environment. And so they just learn how to take it and keep living day to day. It's not an amazing experience, but at least they know how to just persevere. And unfortunately, that is very similar to what physicians go through. They are in this cage that the administration and the healthcare marketplace has constructed. And I was in the same boat. I felt ineffective. I could not affect change. And so you just have to learn how to take it. And some people are better than others at just hunkering down and taking the abuse. And some people do okay. No one thrives while taking the abuse. But some people have learned how to take it better. And so what I've seen and what I've figured out is that, just like you open the door to the cage and there's a whole world for the dog where they're not getting shocked, but yet the dog is scared to leave because he has learned that he cannot affect change. And so he's scared. What's the difference whether he's getting zapped or some unknown experience? Now, we all know that once he leaves the cage, he's going to be so much better off. And that is what I see cash practice for doctors. That is the door, opening the cage and allowing you to have a much better situation, getting out from underneath the abuse, getting out from that learned helplessness where you're just taking the brunt of it every day. Once the door's open, that changes everything. So people always ask me why offering PRP treatments in your medical practice is a good idea. So as you know, PRP is a treatment that uses the concentration of your platelets, and this accelerates healing in your joints, tendons, ligaments. And honestly, the reasons that I always tell all of my friends and colleagues, you need to add PRP to your practice. There's a couple of reasons. Number one, it's a more natural approach. And I think patients are looking for a more natural approach. I can't tell you how many patients come to me like, oh, I'm not a medication person. I'm like, well, what about a natural supplement? Like, oh yeah, absolutely. And so for that patient population, people are really looking for a more holistic, natural approach. Additionally, it is minimally invasive. Being a surgeon, even when I tell people it's minimally invasive, it's still surgery. And still while there's cute little incisions, it's maximum invasion. And so these injection-based therapies of platelet-rich plasma literally are minimally invasive. They're needle-based procedures. They're done in the office under local anesthetic. And so I do think that having a less invasive procedure with less downtime can be beneficial, especially for those patients who are reticent to have surgery or can't take the downtime, can't take the time off, aren't willing to kind of commit to that long period of being off. I think it's perfect for them. Also, as I go along in my practice, I keep finding more and more opportunities for use of platelet-rich plasma. And I sometimes think that I'm just as guilty as someone with where everything, if all you have is a hammer, everything looks like a nail. Now I'm like, oh my gosh, everything needs PRP. But partly that's because it's minimally invasive, it's all natural. Patient outcomes are fantastic. And so it's so versatile. You can use it for arthritis, you can use it for ligament problems, tendon problems, muscle problems, whether it's acute problems, chronic problems, young athletes, non-unions, the geriatric squash playing population. It's so versatile. And maybe I'm guilty of everything looks like a nail and my hammer is PRP, but it is quite beneficial. And then lastly, I am differentiating myself in my market. Of all the other surgeons in my area, some of them provide some opportunity for platelet-rich plasma, but that's not their mainstay. That's not what they're doing. And my mainstay, what I do, my brand of orthopedic care for my patients includes platelet-rich plasma. And so that is a differentiator, and people seek me out because they know that I am a conservative surgeon that chooses non-operative care over operative care, and that I'm doing these cutting-edge treatments to help harness their body's own healing mechanisms. So I really think that's helpful to be offering that platelet-rich plasma to meet the demands of the patients, but also do the right thing with the patient to help them heal and get back to the life that they love. My colleagues always ask me, well, I mean, I've done some PRP, but like, how do you make a business out of it? Like, how do you actually make it successful? I've really struggled. I don't know how to talk to patients. I don't really know how to make it a viable part of my practice. And so, number one, some of it's straightforward and easy, just draw blood, put it in a centrifuge, get your PRP, inject it under ultrasound guidance, and then you're gonna have great results. But there may also be some pre-work that needs to be done, talking about cash services with your patients. I think that's not something that we've learned in medical school, how to talk about pricing. Even how to price your injections is not straightforward. And then ultimately, with the right guidance and resources, it can be done efficiently and effectively. So my favorite way to start integrating is by creating a cash-based micro practice. And creating this infrastructure of a vehicle that can help market the cash-based services, take money, provide patients with impeccable care, all while not scrapping the practice that you already have, just adding on to, coming alongside and having a vehicle by which you can then have a successful orthobiologics cash practice. Now, if you don't know how to do that, don't worry. I have a comprehensive program that I designed. It's called PRP Now, and it has been designed specifically to help busy physicians seamlessly integrate platelet-rich plasma in their practices using this micro practice infrastructure technique, as well as helping to understand the nuts and bolts of platelet-rich plasma, ultrasound-guided injection techniques, marketing techniques without actually marketing, how to talk about money, how to do the consult, all of those things. It's all included. So if you're interested, make sure you click the link below and take a look. I really urge you, let me help you shorten that learning phase. I've already made all those mistakes and missteps, and so this is the shortcut to mastery without having to spend extra time, money, effort that doesn't need to be done. So if you're interested, come along. I'll walk you through this step by step, and we'll get going and get orthobiologic injection-based therapies up and running for your patients.